Hello everyone. Did you know that 60% of people avoid visiting a dentist because of fear of pain, the known and the unknown? So it's not surprising that the tagline painless procedures continues to be the major selling point for a dental practice. Well, the difference between the two patients is pretty obvious. The scenario on the left is the most common, arising due to two aspects: actual pain due to the dental procedures and the fear of pain due to procedures. A dentist needs to fight both. But irrespective of how a patient entered your clinic, if a patient can smile while sitting in the chair and as they walk out of the clinic, then I think we all know that you have truly won them over. At your clinic, would you be able to say, I can guarantee painless local anesthesia and patient comfort? I can always ensure safe administration of anesthesia. I can anesthetize a single tooth without unwanted tongue or lip anesthesia. I can do bilateral mandibular procedures without any worries. I can ensure safe anesthesia even in infections. If your answer is no to any of these, then I'm sure you will say yes by the end of this lecture. It is true that all these are definitely possible with good armamentarium and good instrumentation. So, welcome everyone to this lecture on the armamentarium for local anesthesia. I'm Dr. Ilavenil, professor in the Department of Oral and Maxillofacial Surgery, SRM Dental College, Ramapuram campus. Also, a visiting professor at Shimane University, Japan. So, yes, there is absolutely no doubt that the cornerstone of painless dental practice is local anesthesia. To achieve painless anesthesia, two aspects are very important: the tools and techniques. Tools include the local anesthetic agents, about which it was described in detail in the previous lecture, and the armamentarium, which are the devices used to deliver the local anesthetic agents. Through this lecture, we will explore the various instruments used to administer local anesthetic agents, with our focus on ensuring precision in delivery and enhancing efficacy while negating complications. Let's remember, all patients are not the same. So, to achieve patient satisfaction, we may have to customize our armamentarium. At the same time, let's make ourselves comfortable by choosing what is ergonomic for us. And finally, consider the cost factor and availability of armamentarium in the Indian market. It is important to remember that instruments and their specifications are not the same globally. There is an abundance of instruments we could choose from to cater to specific patient population as well as the clinical scenarios. Unfortunately, we do not use many of the available instruments because of lack of awareness regarding the existing options and to an extent because of lack of understanding about these instruments, their parts or their usage, including methods of sterilization and disposal. The basic armamentarium consists of a syringe, needle, and cartridge, or a multi-dose vial that contains the local anesthetic solution. In addition, there are numerous other devices that facilitate the effective delivery of local anesthetic agents. Each one of these aspects would be covered as separate lectures. So it is a total of 4 lectures under the topic armamentarium. The first lecture is about the syringe. In simple terms, syringe is a carrier of local anesthetic solution and the needle. A syringe is available in multiple types based on its disposability, the constituent material, the method of loading local anesthetic solution, the way it is used, and the method of aspiration that a syringe permits. In addition to the description about the different types of syringes, this lecture will also feature demonstration videos of parts, assembly and use of a cartridge syringe, loading of local anesthetic solution into a cartridge syringe, method of aspiration, and the use of a safety syringe and pressure or intraligamentary syringe. According to the American Dental Association, A standard syringe is supposed to embody certain characteristics which focus on the safety features, cost, ergonomics, and maintenance. A non-disposable syringe must be durable to withstand repeated sterilization. A disposable syringe must be packaged in a sterile container or a packet. And it would be nice to have syringes which are capable of accepting a wide variety of cartridges and needles of different manufacturers. That would be more economical. And syringes must be inexpensive, self-contained, lightweight, and simple to use. They must provide for effective aspiration. That is very, very important, and permit identification of positive aspiration. So our syringes can be disposable or non-disposable, metallic or non-metallic, cartridge bearing or non-cartridge bearing, manual operated or computer controlled, aspirating, non-aspirating, or self-aspirating. Before we go into the description of the various terms and types, here is a quick reality check. If you type the words dental syringe and needle on Google, like what I've done here, this is what Google shows. It is nothing close to what we normally use, isn't it? This is what most of us use here. So let me give you the global scenario. These are my dear friends and colleagues with illustrious careers in different parts of the world. The pictures are self-explanatory. All of them use the syringe that Google showed, the cartridge syringe, for many, many benefits. On that note, let me introduce the different types of syringes one by one. To begin with, the types of syringes based on disposability. The non-disposable or reusable metal syringes, and the familiar, more commonly used syringe in India, the disposable syringes made of plastic. This difference we all can relate to. This is the most commonly used syringe in India for dentistry. But let's understand, these are called hypodermic syringes. Though not contraindicated in dentistry, they are not ideally suited for dental purposes. We'll explain why in the subsequent slides. The next difference that one may notice is the variation in loading the local anesthetic solution. Some syringes, like what is shown here, need to be loaded with LA solution by using pre-filled tiny cylinders. These are therefore called cartridge bearing syringes. While what we see here is well known, we draw local anesthetic solution from a bottle, what is called as a multi-dose vial. These syringes are called non-cartridge syringes. Then we have differentiation based on the material. Here we have both cartridge loading. One is made of metal, chrome or stainless steel. The other, plastic. Plastic is less heavy, rust resistant, and they cost less. Let's get this fact right. Worldwide, the word syringe in a dental clinic is synonymous to a dental cartridge syringe. Now, this is the most commonly used syringe in dentistry. Though the cartridge syringe looks complex, it is easy and safe to use. In addition, it has numerous advantages. Firstly, reusable syringes are an investment for many, many years, while hypodermic syringe means recurring expenditure. Cartridge syringes use cartridges, which is the best form of delivering local anesthetic solution because you avoid cross-contamination 100% and avoid allergy due to methylparaben because cartridges do not have methylparaben. Also, aspiration is easy with cartridge syringe, and the needles are more standardized for cartridge syringes. And some good LA formulations are available only as cartridges. For example, articaine and mepivacaine with levonorepinephrine. So the bottom line here is, figuratively as well as literally, that cartridge syringe is the safer and easier method to deliver local anesthetic solution. And this would definitely be a good practice to initiate in your clinic. Now that we know the benefits of cartridge syringe, let's try to understand this more. The parts of a cartridge syringe are the barrel, which is a cylindrical structure that houses the cartridge. The next important structure is the piston rod or plunger, which has a sharp projection anteriorly called the harpoon and posteriorly the thumb ring or finger bar. The piston is a sliding part of the syringe. Most anteriorly, the threaded tip is present, which engages the needle. Two windows can be appreciated along the barrel, one small and the other long. Now I'm going to demonstrate the various parts of a cartridge syringe. The armamentarium required for delivery of local anesthetic solution include the reusable metallic syringe, the needle, and cartridge or carpule containing the local anesthetic solution. The parts of a syringe include barrel for the cartridge, a piston with harpoon, finger bar, thumb ring, and a threaded hub. This is an aspirating syringe with an arrowhead at the piston end. Two windows are present on either side of the chamber, a small window to check for aspiration and a large window which enables visualization of the entire cartridge. That's a closer look of the harpoon, the piston being pulled backward. The tips of the syringes where the needle engages can be of two types, the European or metric thread needles or the American or imperial thread needles. So you will have to choose your needles based on this. The overall framework varies according to the manufacturer. As you can see, there are numerous types with minor modifications in design. Two are prominent, hook weight and Astra type, based on the type of finger grip and the handle. Harpoons are of many types, according to the manufacturer, each claiming varying degrees of retentiveness into the rubber stopper of the cartridge. The ability of a harpoon to engage the rubber stopper of a cartridge is very important in aspirating. Now let's see how the cartridge that contains a local anesthetic solution is loaded. Three types are common, based on the point of insertion of the cartridge: front loading, side or breech loading, and rear loading. Starting with the breech loading. First, you retract the plunger or piston of the syringe. This is to create space for the cartridge. Then, the tubular vial is inserted. The cartridge is seated properly. Following this, engage the harpoon of the plunger into the rubber stopper of the vial. Now, with rear loading, you open the hinge of the syringe, which is present at the rear end of the syringe, and you bend the syringe at the rear end, exactly at the hinge, like what is shown here. Now this hinge helps in bending the barrel like what you see here, and then the cartridge is loaded from behind. Front loading is reserved to special types of syringes called as pressure or jet syringes. So with this type of syringes, the barrel of the syringe is unscrewed as shown here, and the vial is inserted from the front, and then you reposition the barrel. Now I'm going to demonstrate the two common types of loading the cartridge syringe, the breech loading and the rear loading. This is a demonstration to show loading of an aspirating cartridge syringe. To load, piston is withdrawn using the thumb ring. Cartridge is loaded from the side through the large window. Piston is now pressed to engage the arrowhead or the harpoon onto the rear rubber stopper. That's the position. For the rear end loading syringe, there is a hinge at the back of the barrel which opens to allow the cartridge to be loaded from the rear end of the barrel. Now you bend the syringe at the hinge. This is how it is done. Now the barrel is ready to receive the cartridge. Now I'm going to introduce the cartridge from the rear end. I'm inserting the cartridge. The hinge is now closed to seal the chamber. With a gentle press, you make sure that the harpoon engages the rubber stopper of the cartridge. Now the syringe is loaded and ready to use. That's the final position. Now the needle is secured to the hub of the syringe. Once the aspiration is checked, the plunger is activated by pushing the thumb ring. This expresses the local anesthetic solution through the needle tip. You can see the solution coming out through the bevel of the needle. After LA administration, the needle is unfastened from the syringe and sheathed. Now, the piston is withdrawn. I'm withdrawing the piston to enable removal of the cartridge through the large window of the syringe and gently tease out the cartridge. The next feature of a syringe that I would be describing is very important for safe clinical practice. Accidental intravascular injection is suggested as one of the major causes of immediate complications of local anesthesia. And the best method to avoid this complication is by aspiration. Aspiration is the act of pulling back the syringe piston before injecting the anesthetic. This is done to check if the needle is inside a blood vessel. In the event of entry into a vessel, the act of aspiration would draw blood into the cartridge. This is called as positive aspiration. And when this happens, one must immediately reorient the syringe in case of very minimal streaks of blood and reaspirate. However, when the blood is more, the cartridge must definitely be discarded. So when a syringe helps in aspirating, it is called aspirating syringe. And when it cannot, it is referred to as non-aspirating. For obvious reasons, non-aspirating is not at all preferred. The main difference between an aspirating and non-aspirating syringe is the presence of a harpoon at the end of the piston rod or the plunger. A harpoon is a sharp metallic projection at the end of a piston rod. The hypodermic syringes, what we commonly use, are also aspirating, but it is difficult to aspirate with them. I will show you with a good demonstration to understand better. This is a demonstration of active aspiration using a cartridge syringe as well as a non-cartridge syringe. This is an aspirating syringe, so you all know this has a harpoon at this end of the piston. So let's see how aspiration is being done. For positive aspiration, you need to pull the piston backward. As you do it, observe the small window that is present here. You will find a stream of air rushing in when you aspirate. That is an indication of aspiration. That's a blood vessel. We have gone into a blood vessel. Now the first thing that we all do with the disposable syringes, this is for injection. This is the position. Now when you want to aspirate, you have to come like this. This automatically changes the angulation of the injection, the syringe. And then there, that is the aspiration. Now this is the position of inserting the needle inside. Now I want to aspirate. See that turning red? The angulation of the syringe does not change. So this is called as aspirating because of the harpoon that you have here. So the bottom line is, for an aspirating syringe, whether it is a cartridge loading or a non-cartridge loading syringe, you have to pull the piston or the plunger backward or posteriorly for aspiration. Then we move on to the next generation of syringes, the self-aspirating ones. This was basically designed because even the simple act of retracting the plunger led to very minimal movement of the needle, like what I showed in the video. Hence, the self-aspirating syringes, which do not require the retraction of the plunger. I'm going to explain how these work. Now let's check how this works. The activation of aspiration procedure is done by two methods with a self-aspirating syringe. Slight pressing and releasing at either the thumb disc. This is a special feature of a self-aspirating syringe, or at the plunger. Now, what do these movements do that the syringe aspirates by itself? Here's a trick. Self-aspirating syringes have a tiny metal projection called the aspirating nipple in the inner side of the barrel towards the needle end. Now, pressure exerted by the plunger or the piston gets transferred to the vial or the cartridge. Now, this presses the diaphragm against the aspirating nipple. This deforms the diaphragm. When this happens, there is a change in pressure between the inside and outside. This leads to flow of local anesthetic solution through the needle. When the opposite happens, when you relax, the pressure of the injection is released. The opposite happens. There is relaxation of the diaphragm. You can see the change in the shape of the diaphragm, which creates a negative pressure that draws blood from inside the blood vessel. So this is how a self-aspirating syringe works. Certain aspects need to be checked before using a syringe. A bent harpoon may create an off-center puncture of the rubber diaphragm, leading to breakage of cartridge or leakage of LA solution. A dull harpoon may cause disengagement from the rubber plunger during aspiration. So it is very important to check these before injecting the solution. Maintenance of syringes is very important. You need to wash them after every use. Now this is about reusable syringes, metallic syringes. They need to be autoclaved. After 5 autoclavings, they need to be dismantled and lubricated for effective future use. The harpoon is always cleaned with a brush after every use, and you replace the piston and harpoon as required. The disposable syringes, which are commonly used, have specific advantages. The first being they are disposable, single use, because of which you are completely avoiding cross-contamination between patients. They are sterile until opened and they are lightweight. But the disadvantages are they do not accept pre-filled dental cartridges. Also, as was shown in the video earlier, aspiration is difficult with such syringes. Now, these syringes require 2 hands to aspirate. Also, there is always the possibility of shift in needle position while aspirating. Now, plastic disposable syringes, like I said before, they're common in India. They're available in a variety of sizes with an assortment of needle gauges. The advantages are they are single use, very light, sterile, and much lesser in cost. Based on the type of needle attachment, we have 2 types. Lever lock syringes, which have a collar with internal thread, while lever slip syringes have no collar and just a smooth spigot. Lever slip types are easier to fit. All you need is a push of the needle and you're ready to go. While lever lock syringes must be rotated and twisted to seat the needle. Over the years, syringes have undergone major transformation in constituents and design. Let's look at a few of them. To begin with, the eco syringes. These are cost effective because the aluminum thumb ring and wings have been replaced with stainless steel. Hence, they are economically feasible. The next type would be the syringe with ventilation. These syringes are lightweight. They are made of surgical grade aluminum and stainless steel, which reduces the hand stress during injection. Hence, they are very comfortable to use, and they do not contain any removable parts, which also adds to their lighter weight. Ergonomic syringes are the other popular type of syringes. So these have been designed for every sized hand. You have the standard type with large thumb ring and standard length plunger. There is a fusion type with a medium thumb ring and standard length plunger. You also have a petite size which has a small thumb ring with a standard length plunger. So you could choose according to the size of the operator. The other ergonomic design includes the incorporation of a half ring. As you can see here, this offers free space to the index finger when pushing the back end. Now, to something very important to dentists, the risk of needle stick injury. According to the World Health Organization, the incidence of needle stick injury is about 2 million, with 1.3 million deaths from unsafe injection practices. There is a steep rise in needle stick injury, especially among the dentists who are at higher risk. The single most important cause of needle stick injury amongst the dentists has been unsafe practices followed during recapping of syringes. So, do we have anything to protect ourselves? Safety syringes provided the much needed safety to dentists. These syringes have a built in safety mechanism which reduces the risk of needle stick injury. The needle on a safety syringe can be detachable or permanently attached. The syringe has a sheath over the needle, and the sheath can be retracted into the barrel. The advantages of safety syringes are many. They are disposable and single use, they are sterile until opened, lightweight. There is no change in the technique that you're going to use. You can follow the conventional techniques that you always follow, and they are compatible with any needle. The protective sheath that comes along, it permanently locks after your final use of the needle. Here's a demonstration of a safety syringe. Dr. Kandasamy was kind enough to share a video.
So this comes as a disposable separate to plunger. So you can see it's a sliding concept. So that goes in, and then the plunger goes in, lock it in, and then slides down. So it gives you a needle protection. Once I take it, I can still do the cover like this. One click is for recapture it back again. So one clip and you can lay it down safely, and if you want it again you can slip it back. So double click is completely locked, and then you can throw it in the needle disposable bin, and it's safe to use without getting needle sticks. And this is often comes as a separate sterilizable unit, so you don't need to buy it again. With the stainless steel one, the resheathing needle injury is high. Hence, European guidelines asked us to use single-use safety syringes.
The next variation of syringes is a pressure syringe, which are exclusive for periodontal ligament or intraligamentary injections. For you to understand why these are called pressure syringes, let me briefly explain what an intraligamentary injection is. Please remember, the periodontal ligament space is narrow. So you need lots of pressure for diffusion of solution to the periapical region where the nerves are. Additionally, this pressure helps in forcing the anesthetic solution into the surrounding cancellous bone for more effectiveness. Normal needles do not provide the adequate pressure, while pressure needles generate the much needed pressure as well as the mechanical advantage to the operator in overcoming the tissue resistance. So you have easy delivery, more effective volume of solution being delivered closer to the nerves. The first generation devices were bigger and complex and also required the pistol grip. As you can see from the pictures here, the gadgets were huge. But the second generation devices were less complex and are manageable with a pen grip. These pressure syringes have inbuilt safety measures with adequate control over delivery of the local anesthetic solution. 0.2 ml is delivered at a rate not less than 20 seconds. Also, the cartridges are well protected to avoid shattering of cartridge. It is important to note that each squeeze of the trigger provides a volume of 0.2 ml of local anesthetic solution. However, this can vary with the system used. For example, the Voltec system, which will be demonstrated later, delivers 0.06 ml per squeeze. Also remember, the ideal needle to be used is a short or ultra short needle of 30 or 27 gauge. The indications are as a supplementary injection to the conventional techniques, especially when they fail, single tooth anesthesia when you do not want the disadvantages associated with the routine blocks, like the adjacent soft tissue anesthesia of the lip or the tongue. It is also very useful in patients with bleeding disorders where you do not want the technique to be more invasive. Also, these injections avoid the complications and side effects of block anesthesia. Here's a demonstration of the pressure syringe. This is a demonstration of the intraligamental injection using the wall-jectin system. The armamentarium includes injector, cartridge, and needle. The cartridge holder receives the cartridge. The lever activates the delivery. Graduated piston for controlled delivery of 0.6 ml every activation. The reset button to reset the piston, and the angulated hub to angulate the needle. First, the cartridge holder is disconnected from the injector. You just have to twist it and remove it. It's very simple. Now it is dismantled. Then the cartridge is loaded into the cartridge holder. This cartridge holder also has a window. Now the loaded cartridge holder is reconnected to the injector. You just twist and push and it's all ready. Notice the angulated hub to which we will connect the needle now. The needle is now removed from its sheathed case. It is threaded to the angulated hub of the syringe. The cap is removed and now the syringe is ready to use. That's a close-up view. You see the angulation of the syringe. It's very convenient for intraligamental injection. That's the activation of the lever. That's how you activate the system. Every activation expresses 0.6 ml of local anesthetic solution. That's how the solution is expressed because of a graduated piston. The piston moves in increments with every activation of the lever. So every fragmented move, 0.6 ml of solution is expressed. Now you use the reset button to reset the piston. Now the piston is gone inside completely and you're ready to use it again. That's how a jet of local anesthetic solution gets expressed. The same in slow motion. With minimal manual effort, the pressure generated is tremendous, very effective. With this, we come to the end of the first lecture on syringes. And here's a summary. Always choose syringes according to ADA specifications. Cartridge-bearing syringe is always better than hypodermic syringes. And aspirating syringes is an absolute necessity, no compromise on that. Ergonomic syringes may be chosen for dentists' well-being. Safety syringes to prevent needle stick injury and infection. Periodic maintenance is essential for longevity of your syringes. Always check for structural integrity before using the syringes. And choose pressure syringes for periodontal ligament injections. Thank you.